fracture. So Leaphart is the one scientist who was doing experiments on skulls, how these maxillary fractures are occurring. So how these maxillary fractures are occurring, as you could see. Hi, good evening everybody. So if you have a basic idea of what are the fractures of the facial skeleton that you can have in the mind. So most of the times if you take, this is the skull like this is the pyriform aperture, and this is about our, you know, so about the maxilla and mandible joint. So you have got something like this, is it or not? This is just for easy understanding. So upper third of the face, middle third of the face, and lower third of the face. So you divide into third, and one third. So most important among these will be the Leaphart fractures. Leaphart fractures, fracture of the maxilla, which is very important. So there are three types of Leaphart fractures, as you could see in this picture. If we try to draw, so I'm not going to details of every of the fracture. So most importantly, fractured bone is the nasal bone, as you could see. So Leaphart fracture, if you take like this, pyriform aperture, and this is the skull being like this. So as simple as that to remember. Okay. So three words you remember: G, P, C. G for Gurain, P for pyramidal, C for craniofacial disjunction. Craniofacial disjunction. Disjunction. There are a lot of things that we remember over here, but let's have. So type 1 is Gurain, 2 and 3. Craniofacial means the face and the cranium are going to be separated. So nasal bones as a part you should take at the bridge of the nose. This is the bridge of the nose, for example, suppose. Okay. And then what is the basic anchor bone here is the, remember about the pterygoid plate. PP is the pterygoid plate that is present below the skull. At this point, if you take the skull behind, there will be two plates here called as medial pterygoid plate, lateral pterygoid plate. Okay. So type 1 Gurain goes through lower part through the pterygoid plates, type 2, and type 3 is upper part of the pterygoid plates, type 3, as you can just remember like this. Okay. As you can just remember like this. So Gurain, pyramidal and craniofacial disjunction. So second one, it goes through the lacrimal bone. Just remember, lacrimal goes through the lacrimal bone. Okay. So this is the bridge of the nose or root of the nose, as you can say. Second one goes through the lacrimal bone. Okay. Third one, most importantly, goes through superior orbital fissure. So I am just telling you the key points in the superior orbital fissure. Through the level of superior orbital fissure, which would be over here, is it or not? Superior orbital fissure will be like this in this particular point. So second one goes through lacrimal bone. First one is lateral part of the nasal septum. Okay. First one is through the lateral part of the nasal septum. So it goes through the nasal septum, and second one is through the lacrimal bone. Third one is superior orbital fissure. So third one, the destination of third one is, okay, zygomatico-frontal suture, zygomatico-temporal suture. I call it as Jaffa suture and Jatta suture. So zygomatico-frontal, zygomatico-temporal. Okay, zygomatico-temporal. So it goes through that, and it goes through the upper part of the pterygoid plates, so that the calvarium is separated, and then this particular lower part of the face is separated. So you can just brand them as, if you try to draw the fracture lines, they will be like this. Second one will be like this. So second one, it will be going, if this is the maxilla, at the above the level of the maxilla. Okay, above the level of maxilla. First one will be going below the level of maxilla, root of the nose. Okay, lateral part of the nasal septum. So above the level of, just below the level of maxilla. This is the maxillary sinus, MS. First one will be going like this, second one will be going like this, third one also will be going like this. So second one will be going through the floor of the orbit. Third one will be going through the lateral part and superolateral part of the orbit like this. So just as simple as that. So type 1 is below, type 2 and type 3. So these are the basic things that you have to remember. Type 1 is Gurain, type 2 is pyramidal, type 3 is craniofacial disjunction. So just type 2 pyramidal fractures, they are almost similar to zygomatic fractures. Zygomatic fractures. Zygoma fractures. Just these are the basic concepts of this particular full view you want. The basic concepts of this particular fractures. As you can see, just simply as that. So Gurain, pyramidal and craniofacial disjunction. So Gurain goes to this particular lower part of the nose and the lateral part of the lower part of the nasal septum. LNS is lower and lateral part of the nasal septum. So type 1 goes through lateral part of the nasal septum. Type 2 is going through, as you can see, the most important chief anchor bone is lacrimal bone towards and then towards the floor of the orbit and then going back. So where is type 1 going? Through the lower part of the pterygoid plate. This is pterygoid plate. So type 1 is going through the lower part of the pterygoid plate, type 2 is going to the middle part, type 3 is going through the upper part of the pterygoid plate. So type 3 is going to form. So type 3 fracture is there. What is going to happen? So upper part of the craniofacial disjunction. This is cranium. This is face. This is craniofacial disjunction. So type 3 is going to lead to this type of fractures. This is just the basic of it. After seeing that, Guerin pyramidal. What is Guerin is just a scientist name. Okay, Guerin, G-E-U-R-E-N, Guerin pyramidal and craniofacial disjunction. These are the three names that are given. So from bottom to top, it goes from bottom to top. So now we'll go into the discussion part of the bits. So the basic understanding of these concepts. I hope most of you people understood. Okay, so good evening everybody. Next, which is a bone of the, not a bone of the nasal septum, not a bone of the nasal septum. Which is not a bone of the nasal septum means ethmoid, vomer, lacrimal bone and maxilla. Ethmoid, vomer, lacrimal bone and maxilla. So once you should have idea about the nasal septum also. It's just like remembering like this and then forgetting permanently is not the solution. A small diagram will make you easy remembrance. Easy remembrance, as you could see. Same see. From the lateral part, you are going to draw a diagram like this. For example, this is the nose from the lateral part. So this is the hard palate, is it or not? Hard palate, this will be the soft palate. This will be the soft palate, this is the hard palate, okay. So here will be the frontal bone, as you could see, here will be the frontal bone. This particular part is called nasal spine of frontal bone, NSFB, nasal spine of frontal bone. This particular part is called as anterior nasal spine of maxilla. Nasal spine of frontal bone, anterior nasal spine of maxilla. You are drawing a line called, imaginary line called as Cottle's line. So Cottle's line. Epistaxis in front will be the anterior epistaxis, posterior will be the posterior epistaxis. This is for understanding of the anatomy along with this cartilage and bones. So what will you have at the end of the day? You will have something, a gun shaped structure here, is it or not? A gun like structure. What is this? It is called as sphenoid bone. It is called as sphenoid bone, gun shaped structure like this. You have got something called as rostrum. This is just like a rashtra, Telangana Raj or rostrum. Okay, is it the rostrum of the sphenoid? Rostrum of the sphenoid. So what will you have? Anteriorly there will be something called as. So we'll try to remove this Cottle's line now to understand. So this will be the quadrangular shaped cartilage called as QC. What is quality control or quadrangular cartilage? Quadrangular or septal cartilage. Okay. Just remember like this, QC code. So this perpendicular plate of ethmoid. This is perpendicular plate of ethmoid. As you could see, cribriform plate will be there, olfactory nerves will be coming like this. This is the perpendicular plate of ethmoid. And the most thinnest part is nothing but your vomer. Thinnest part of septum is vomer. So vomer, this is a vomer. This is the maxilla. So anterior part is called as premaxilla, of course. Anterior part is called as premaxilla. So this will be the quadrangular cartilage, perpendicular plate of ethmoid, vomer. So this is the sphenoid, rostrum of the sphenoid. Okay, as you could see. So then at the end you will be reaching the something called as choana, which is a blind space. This is the open space in the posterior part towards the nasopharynx. This is the anatomy of the septum. We have seen a lot of things before also. So now we will understand. So lacrimal is lacrimal bone. Rituraj, lacrimal is lacrimal bone. It runs through the lacrimal bone. So we are going to the bit directly right now, as you could see. So ethmoid, vomer, lacrimal bone, maxilla. So lacrimal bone is nowhere seen over here. Lacrimal bone is over at this medial, so infromedial part of the orbit. It will be there. So this is the maxilla. This is the frontal bone. This is the maxilla. This is the frontal bone. There is something called as FPM, frontal process of maxilla. So once there is frontal process of maxilla, behind there is something called as lacrimal bone. If this is my frontal process of maxilla on the right side, this will be the lacrimal bone. If you say namaste, so stylish way of saying namaste to all. Okay. So how would you say namaste? This is the frontal process of maxilla. This is the lacrimal bone. In between these two, if I hold something like this, for example, this is the lacrimal sac. in between these two, if I hold like this, my alignment will be like this. Okay, my alignment will be like this. So this uncinate process which I was telling before, uncinate process of the ethmoid bone is in the posterior part of the lacrimal bone, anteriorly posterior edge of lacrimal bone. From this lacrimal bone, it is going to the superior edge of inferior terminus. So this lacrimal apparatus will be lying at this particular point. So as you could understand in that manner. Okay. Board ones, you want board ones, okay, you can see the board here. Okay, the answer here will be the lacrimal bone. As you could see, this is the maxilla, this is per quadrangular cartilage, this is a perpendicular plate of ethmoid, this is a vomer. So that is the rostrum of the sphenoid over here. Bones in the nasal septum. Okay, I don't mind you remembering these as mnemonics, but sometimes if you have psychological concept of drawing the diagrams like that, you can remember it for a longer time. It's everybody has their own style of remembering. Okay, I don't want to impose that you have to remember like this only. So everybody has got their own way of remembering. Is it or not? So maxillary, my very fine nasal septum. Okay, M is maxillary, V is vomer, F is frontal, N is nasal, and then septum is sphenoid. So this is nasal bone. Actually, this lies on the wherever my spectacles are resting. That is the nasal bones. So these are the nasal bones. So they are not directly a part of the nasal septum, but they are indirectly related to the nasal septum. So as you could see, this is a perpendicular plate of ethmoid, septal cartilage, vomer, rostrum of the sphenoid, and this is a nasal spine of frontal bone, crust of the nasal bone. Crust of nasal bone is going to be forming, but it is not directly related to the septum. Okay, this is columellar septum, membranous septum, septum proper. Columellar septum, this is the columellar septum, membranous above which is the membranous septum where you feed the studs of the nose, and above it is the septal cartilage. This is the crust of the maxilla, this is the vomer, this is the rostrum of the sphenoid, crust of palatine bone. So crust of palatine bone. So palatine bones, like if you take the palatine bones, very full view of the board, sir. Okay, imagine let them see the full view of the board. Anyhow, the picture is over here. So if you take the perpendicular plate, like you are becoming a director like this. Okay, go behind, stand behind the nose, go behind and stand behind the nasal cavity into the nasal cavity at the choana level. You just see from there, you will see the perpendicular plate of palatine bones will be like this. So anteriorly will be the maxilla here, behind it will be two perpendicular plate. Okay, perpendicular plate of palatine bones. It will be like, they will be like this. Okay, they will be like this, like a anchor shape. Two anchors are joining together, so it will become the perpendicular plate of palatine bone like that. So that is the understanding of septum from behind, from the choana side. Okay.